Hi guys, today's Wellness Wednesday and Doug is next to me finally. I'm so glad to see her. So today we're talking about the cholesterol, right? The cholesterol issues, it's a very common problem, what you see in the practice, right?
Correct. So we're gonna do a quick rundown of what we see in a common lipid panel. It's not your advanced lipid profile testing, it's the common ones that most physicians order for patients nowadays. Your total cholesterol is a buildup of kind of the good, the bad, the ugly. It's somewhat calculated and it gives you an idea of where your total cholesterol is together. It's not something we harden, you stick to, but it generally needs to be less than 200, okay?
Okay.
The really good structural cholesterol, we call them high density lipoproteins, HDL. I think of them as the fireman fats. And so they're the ones that are structurally needed. They do good for the body. They're the ones that we need to build up, and it's a necessity for us to have those. And when we talk about cholesterol, those are the ones we're looking at in our diet with Mediterranean fats, nuts, nut butters, oils, things like that to really help build up good nutritionally. Seafood too, like certain fishes,
Right, fishes, right.
Specific fish. The really, really bad ones, the very low density VLDL, or in our blood work, usually comes out as triglycerides. And they're the fluffy, we call them like cotton candy fats because they have 3 sugars, triglycerides, on 1 fat. And so when you think about it, it's the ones that can break down, and we see most diabetics have high triglycerides for that reason. They're breaking down your sugars, and vice versa. Your sugars go up, you get higher trigs. And those are the ones we think of, again, as benign, but still a little bit of a problem. You don't want them. I think of it visually, again, like sumo wrestlers. They're great. They have a sport. They know what they're doing, but it's extraneous fat. It's unnecessary fat. You don't need it, but it's there, but it's not quite as problematic as are LDLs. Those are the ones kind of in the middle, maybe more towards the bad side, but they're actually the ones that are causing the most damage in the body.
Sure.
So when you break down an LDL, it's delineated as low density lipoprotein. So it's not quite as good as your HDL, and it's not as sugary or fatty per se as your very low density lipoprotein, but it is the one that sticks to our arteries and causes that heart disease. So low density lipoprotein is the one we always hone in on, like you've got to get that down, you got to get that down. And so when we look at studies, those are numbers that used to be somewhere 160 for brand new spanking patient, that's fine. They moved it to 130, now they're pushing us to 100. And those are all levels that we are taught to help in order to prevention of disease. The biggest thing that I like to talk to my patients about is nutrition.
Absolutely, and so then again, from the sport nutrition standpoint, I learned something from my books. Basically, they always were referring that you need to compare, once you have your lipid panel and your doctor explains it to you, that you're not supposed to have more than twice as much tags basically compared to your total cholesterol. Is it correct?
Yeah, so I like to go more towards 1.5. I'm a bit more conservative when we look at triglycerides, because once I see those triglycerides going up to 1.5, double the amount of your total cholesterol, you know that there is a significant issue probably with the sugar.
Yeah,
okay?
so you've taken too much.
Processing of that sugar. Now, if you are a diabetic and you have everything good and your trigs are high, I know you've been cheating, because those are the things that we can see. So triglycerides to total cholesterol, yes, at least 2 to 1 or less, if not 1.5.
Got it.
Times, meaning 1.5 as the triglycerides to the totals. It would be ideal if it could be about 1 to 1. That's an ideal ratio. And when we look at total cholesterol to good cholesterol, that's the one we see more often on our panels, and that should be about 3.5, give or take, to less, meaning total 3.5 to HDL 1, give or take, that should be what it is.
Right.
Because standards for women and men are different as far as HDL, so that ratio is really nice to see. And I like using that ratio because if a patient has super high good cholesterol, we know their fireman fats are really good, but then their LDL's kind of high too. You can get the ratio to give us the true idea of what's going on, so we can base our predicaments on that. We know that LDL needs to go down. We know it causes issues. And I'm not saying that medicine is not good. We all want our patients to do the best for themselves so we can use the medicines when it's needed appropriately.
Absolutely, yeah. So then again, it's basically they have to make sure that they are paying attention, because more than 3.5 times, it's definitely going to attack their heart. So they're going to be higher and higher risk. Up to 5.5 and above that, you're going to have very high risk of cardiovascular problems.
Yeah, cardiovascular, we think of that, and the circulation goes to the brain, the kidneys, the liver, and the legs and arms. So It's everywhere. But we think about it as heart because usually patients say, oh my God, I had a heart attack, now fix me. And it's like, no, we tried to fix you to prevent heart attack,
Correct.
stroke, and all that. So remember, when we're trying to do that, we're not trying to get you to be on medicines all the time. At least I know I'm not. It's a matter of trying to get you to a point where we keep you from having to be on medications later on.
So after all, what we're trying to say is you need to pay attention for your nutrition, obviously, what we always preach about,
Yep.
focusing on the lower glycemic index carbohydrates, consuming. You always want to make sure that you also consume some protein with every single meal, which is going to help you with balancing your blood sugars, it's help you with your fat loss and whatnot, and also exercise again to keep your heart healthy. So this is why we do these little tiny little webinars. I hope you guys are listening. If you guys have any questions, please let us know. Exercise is medicine, guys.
Nutrition is the key.